that haven't met me, my name is Kenny Gibson. I'm the chief listener within the NHS when it comes to all matters safeguarding, all ages safeguarding. And James, I've never been called a headliner before. I know a lot of words. A lot of words are used about Kenny, but never headliner. I'm quite embarrassed. Anyway, colleagues, I'm here to update us on the child social care reforms. And you might think to yourself, that's strange and safeguarding adult week. But remember, in independent providers, more so than any other type of provider looking after NHS patients with registrant colleagues and carer colleagues, we're all one family. And child social care reforms, as we go through it, you'll realise the impact on you as a registrant, as a carer, but also you as a citizen and you as a member of a family, you as a member of a community, because some of you will have children, people living in your household, in your community, who are children that might fit into the child social care reforms as well. So I'm going to update you as independent healthcare providers, clinicians and carers, but also as citizens. I never use presentations. I've sent Philip a sort of slide deck, and you'll get it, but it's more of a sort of update that I want to encapsulate what we've heard about. Hasn't it been a marvelous day? I know Philip is going to do an update, but from homelessness to food refusal in prisons, organisational abuse, the training update from the Priory, bring yourself to the table around safeguarding. I love the shirt there, Philip, rather than today's shades of grey shirt, and more recently from James, domestic homicide reviews. Just a heads up, not about child social care reforms, but DHRs. We've received the first draft of the new revised statutory domestic homicide review template. They are marvellous. They've listened to you, they've listened to us, and you will see the flourishing of trauma-informed domestic homicide reviews that includes death by suicide because of coercive and controlling behaviour. So keep your voice coming in, folks. It does make a difference. But child social care reforms, as we know, children are prone to willful neglect, self-neglect, abuse, exploitation of all descriptions. And even before COVID, but since COVID, that has exploded online. It's exploded in families and households, communities, and in places and spaces of education. And independent providers and you as registrants and carers, you see the impact of that when children, young people, adolescents, even babies come before your systems. And so, two important dates that we need to have in your diary. They are noted in the presentation. So the dates are the 14th of December, the 14th this year, the 14th of December this year, the Department of Education will be launching a child digital safeguarding strategy with a child safeguarding data sharing template. 44 years I've waited for this, and thankfully there's going to be a single template. It's called the Somerset template, and there will be a digital strategy that sits alongside it. Now, from the 14th of December, I want you and I want us and I want the regions, anyone linked to safeguarding, to bring this to life. If we can make safeguarding work, if we can make data sharing work for safeguarded children, we will make it work for the rest of them. So let's work together from the 14th of December. We'll make sure through your independent healthcare providers network, you get it when it arrives into my box. So 14th of December, data sharing and digital. 15th of December, it's a busy week. 15th of December, we've got the social care reforms guidance coming out, along with a revision of working together. Now, what does that mean for you as providers? Because you are part of the NHS family. You see children who use NHS services. You see families and young people and adolescents that use NHS GPs. From an organisational point of view, there will be certain new assurances required within the system. One of them might impact you if you're part of your provider collaboratives, not only mental health collaboratives, but maybe community collaboratives or public health collaboratives, or maybe linkages in with primary care networks. This is important because under child social care reform, there is a recognition that some children need additional health needs. And it is likely that we, health, will be asked to stand up something that is not a Section 17 under the scrutiny of social workers, but is a health action plan led by, delivered by lead professionals in health. Now, what I've heard today is marvellous examples of learning from excellence, consultant nurses, consultant clinicians, leading the care, the wraparound care of not only before they came into an admission, but the recovery after the admission. So organisations together, not individually, but together across collaboratives, will be asked to stand up lead professionals. So just to take a step back from a Section 17 referral, a child in need referral, to work collaboratively around that. So that's exciting times. And I am certain I'll find independent health provider colleagues rallying to that cause of lead providers. We're also looking for provider collaboratives to become corporate parents. Now, you might say independent healthcare providers, but if you had a child looked after, or you had a child on CPIS, then wouldn't it be marvellous to be part of that Happy Birthday 16 care leavers offer? To be able to say to them, come in and see your medical record, come in and see your health record. And at 17, to be come in and get social prescribing through us, come in and get free prescriptions until you're 25. So it's really important under the child social care reforms that independent health providers, your boards, the clinicians, the registrants, buy into this idea that you, as a body corporate, could be care leaver offer in terms of prescribing, social prescribing, and medication prescribing, and seeing and understanding their health record. Wouldn't that be marvellous? But maybe we can be braver, colleagues. Children in care, children in need, and children that have gone through a mental health crisis, they have a lived experience that is second to none. And so healthcare providers, independent or NHS in their full right, maybe what we need to look at is the courage to offer them the covenant. Why couldn't we sponsor apprentices, care apprentices, to make them ready for care education, professional registration education through university, by maybe bringing them in as a care apprentice, or maybe offering them career counselling that independent healthcare providers and NHS healthcare providers, it's a marvellous career. Look at us. Look at how we shine, whether we're an allied health professional, nurse registered, social worker. We're all here to care for children. So we need to get more lived experience cared for children into the care sector through the Care Leavers Covenant. The social care reforms also brings a new narrative. Many of us who have been nursing for as long as I have and lost all my hair through it and gone grey through it, 44 years this year I've been nursing alongside many of you in the last 6 years in safeguarding. We changed the narrative. We had Toxic Trio in 1990. We had Troubled Families in the noughties. Wasn't that a label that was quite disgraceful to think about labelling and blaming troubled families? We had adverse childhood experiences, and even more recently, Think Family. But we know, because of the feedback you've given us, under current demographics and the way that children live, and recover, they don't live in families. They might live in a household. They might live in a community. They might live in a regulated care system. They might live in a care home. So we need to think of shifting our narrative contemporaneously through the voice of the child. And that is absolutely critical for transitional ages. We have got to bear witness not only to independent inquiries, not only to domestic homicide reviews, not only to joint targeted area inspections, and certainly not only to organisational abuse of safeguarding adult reviews such as Joanna, John, and Ben. But we've got to bear witness to the narrative that young people are bringing. And so we are going to stand with SAN and bear witness to the need for more research, more evidence, more local practitioner intelligence than on transitional ages, transitional safeguarding, 15 to 25. Let's have this moment when I noticed that many clinicians will call it anecdote. It isn't anecdote. If it comes from the mouths of children or the voice of families or the voice of carers, let's call it local practitioner intelligence and shift the dial for the need to have more evidence on transitional safeguarding. Now, we also have a moment of 200 million pounds coming into systems near you within the next 2 years. Where does that come from? Well, that's additional funding that about 100 local authorities are about to get under the Section 31 grant. There's Family First, Family Network, Staying Close, and regional care cooperatives. In the slide pack you'll see the named local authorities. So what I want you to do as a system leader, as a practitioner, is find which local authority is going to receive that funding. Roll your seat up to the table of the integrated care partnership and say, look, we deliver for children in need. We deliver for children in distress. How can we help you forge 200 million pounds worth of improved care, not only in their home or where they live, but whilst they're admitted to us and with us, and their recovery afterwards. It is really important, colleagues, we work through in integrated care partnerships for this additional 200 million pounds that about 100 local authorities will share. And as soon as we know the local authority names, we will bring a matrix and a map to you. So there's an awful lot happening. The biggest thing that is happening, and that I just want to bring that hope with the feedback that you've given, is what I started with, is this data sharing. Because, colleagues, we have got to fix for once and for all an integrated data digital system. Not only between us, not only between primary care, not only between primary care and acute, hospitals, NHS, but between independent providers. But we have to be braver, we have to be bolder, and we have got to begin positioning that data belongs to children. It belongs to transitional ages, and so it needs to be fed in to a health passport and a child adolescent health passport. So probably by 2026, certainly during the digital strategy consultation, we really want to welcome your allyship, your collaboration, and say, okay, it's one thing to share data to the Department of Education. It's one thing to share data between us as providers to protect children, but let's do the right thing and give children their health data back. So all of this is contained within the slides, but the 15th, the 14th for data sharing, the 15th for child social care reforms will be an important moment for us to come back through SAN, come back through this fabulous network and say, so what and what next? From about mid-January onwards, we've got to collect your ideas, collect your learning from excellence, collect all the trauma-informed approaches I've heard about from the providers in the marvellous presentations, and we need to squeeze those into the DFE, and you need to take them, and we need to find your seat at the Integrated Care Partnership in the early part of April, May and June. It's a busy time, but we know you're up for it because you've got loads of mojo for reacting to children because they live in families and they're part of your communities. Thank you for listening. Hopefully it's brought a bit of hope that we're almost there sorting out child social care reforms, and independent healthcare providers and the registrants who work there, the carers, you now will be brought to the table so that we can collate your ideas and bring it to life. Thank you.
Thank you so much, Kenny. It's again, lots of kind of round of applause and thumbs up coming from the chat there. That kind of overarching commitment to bring everyone together is absolutely crucial. And as you've reflected, there's a number of things going on at the moment. We've got the reforms. It feels like 1 million consultations going on at the moment.
There's 11 consultations going on at the moment, and what I've heard from these sessions is very authentic. I mean, part of the previous conversations was thinking the unthinkable. Now we've got to aspire the hopefulness because of that 200 million. So yes, I've heard so much excellence on this session. So let's bring everyone in. Let's get the voices gathered.
Thank you so much, Kenny. And that brings us on to our closing remarks. So I'm going to, so David's joining us again for the closing remarks. And I mean, aside from me saying a huge thank you to our brilliant presenters, before I kind of am at risk of, as my colleagues hear me say quite a lot, kind of getting on a pedestal and riding it around on top of a high horse, kind of with some final messages. Just want to bring David in to kind of offer any of his thoughts.
Great, thanks, Phil. And Kenny, thank you. I was just reflecting, Kenny, when we first met at the start of my time at Signet and how far safeguarding has come, how far involvement of the independent sector into national safeguarding has come. And that's down to you and all the colleagues. And I think it's really heartening to see, really. And I think today there's been some really inspirational speakers. We've had lots of learning, lots of sharing of good practice, which is what this is all about. And I think we'll see the Independent Health Provider Safeguarding Forum going from strength to strength. I think it's fantastic. We're doing similar things in other areas around patient safety. So I think it's about all the providers working together to improve patient safety, because this is what it's all about, really. This is why we came into these jobs, and this is what our driving force is. It's about making sure our young people, our adults, those in healthcare, those in social care are safe, and we provide the very best that we can ever provide. So thank you, guys. Thanks for all of your presentations today, your thoughts, your feelings. And I'll just hand back to Phil now for some, I think he wants to share some thoughts with you. So thank you, and I hope to see many of you very soon.
Thank you, David. Thank you. And Christopher, you've just asked in the chat about recordings. So we've tried to record each presentation separately. Our plan is to upload them, and we'll probably host them on the Signet website, where we've got a bit of space there alongside the presentations and PDFs of slides where possible. So as David said, it's a really big thank you to everyone. We've had some brilliant presenters. And as David mentioned right at the start of the day, it's incredibly important to bring people together. And whilst the forum does that regularly, events like this are a real celebration of practice and a great opportunity to share that practice. Well, I realise I forgot to mention when talking about the costs of going big with your advanced training and doing it in person, we've actually calculated the cost per delegate is cheaper than using an external provider, as I mentioned, but that also includes the overnight stay and meals as well. So back to closing thoughts. So an overarching reflection, and from the learning shared this morning in the morning sessions, the presentations about staff development, about staff support, and then right through to the end of the conference, we've really recognised the importance of an individual response to an individual situation. And it's wonderful to hear how many of us are really embracing the true values of making safeguarding personal. And Walter and Heather reminded us that Safeguarding Adults reviews are about learning, not about apportioning blame. And that's what this forum's about. It's what today is about. It's about learning. And we've reflected today as well about how important it is to be at the table or be on the menu. And we now have our own table with this forum. So genuinely, if you're an independent health provider lead and you're not already a member, please do get in touch. And like all of you, I imagine, like it's really common to be asked, how do you do your job? Or you get comments like, oh, I don't know how you do your job. And for me, the answer is really quite simple. We do our job by being kind. We do it by being kind to each other, kind to the people we support. We get things done by being kind, and we do things better by being kind. We build relationships and people come to us and people trust us because we're kind. And you can have all the knowledge and all the power or the darkest blue uniform or the most initials after your name, and none of that really matters when someone's been abused or when someone needs help or when someone's embarrassed because they don't know what to do or perhaps they've made a mistake. It's that kindness which holds the door open. It's that kindness which warms your room. And that's what will allow people to come to you. And I think that we're really lucky that we get to do our job and that we do it best by being lovely to people. So in the spirit of National Safeguarding Adults Week, please be kind to each other and crucially, be kind to yourselves. So thank you everybody so much for joining us today. You genuinely all are brilliant. I'm going to kind of move to our thank you slide to end the day and turn the cameras off in a second, stop recording. Thank you for all the lovely comments in the chat. Thank you for the questions. Thank you for engaging. Thank you for sticking with us with the kind of predictable kind of IT kind of challenges and stuff like that. You're all absolutely brilliant, and please do take the opportunity to look after yourselves. So thank you so much.